A first of its kind report from the American Cancer Society is shedding new light on cancer risks for LGBTQ people. It finds that some LGBTQ populations are more likely to have cancer risk factors like smoking, heavy alcohol use, or excess body weight. Transgender people are less likely to be screened for cervical, colorectal, and prostate cancer. And LGBTQ people continue to face barriers to high quality health care, including discrimination. Dr. William Dayhut is the American Cancer Society's chief scientific officer. Dr. Dayhut, this is the first time this has been being done. This is being looked into. Why now? Why did you decide to do this now?
Well, thanks very much for having me on today. It's really a great question. It's really important to know that this was really a way for us to get a clue to the cancer risk to this population. Cancer communities, cancer registries do not collect data for cancer deaths, cancer incidents based on sexual orientation or gender. So I think this is really important to begin to understand, is the risk different? So we begin to capture that information in a much more critical way.
Were there things in your findings that surprised you? And what do you think are the key takeaways from this report?
Yeah, a couple of things are really important. I think, first of all, you really need to disaggregate the data by the population. This isn't really one homogeneous group. So, certain groups, I think, as you commented on early on, looking at bisexual women in their 40s and 50s, much higher alcohol use, obesity use, tobacco use. These are real risk factors for cancers. Other things were also interesting. Overall, the vaccination rates were actually fairly similar to other populations, the cisgender populations. I think that was good news. Screening rates are fairly good, except, as you mentioned, in transgender men, where there's much fewer screenings done for colorectal cancer and transgender men with the cervix or cervical cancer and prostate cancer. So there's a lot of variety, I think.
The risk factors, are these directly related to being gay or lesbian or transgender, or is it also part of because of the stress that comes along with the stigma of being in those communities?
Well, the risk factors themselves are really risk factors for anybody to have cancer. Our data, there's about 40 to 42% of cancers are actually preventable. And probably the risk of dying from cancer is actually the risk prevention. It's much probably easier to prevent dying from cancer by changing behavior. And so we focus on those behaviors, alcohol use, obesity, tobacco use. And we did see them higher in population, particularly in the bisexual women. And so that gives us concern that there'll be a higher risk of cancer rates and deaths. And then if folks are not seeking medical care because of biases, then there's likelihood that people will present with even more advanced disease and have poor outcomes.
You mentioned biases. How much of this has to do with the culture of maybe society or medical care? Along with this report, there was a study came out from Dana-Farber Cancer Institute that said 80% of LGBTQ cancer patients they surveyed said they didn't get appropriate preventative screening. 34% said their partners felt welcome in the part of their treatment, and only 4% of the partners said they felt respected by caregivers.
Yeah, it really is concerning. There was one fact that the paper pointed out that only about 25% of current medical students actually feel comfortable in taking care of transgender individuals. And 30%, there was really a sense of potential perceived bias, actually, when you thought about it. So I think seeing this hesitancy to seek medical care for real and perceived bias can actually lead to much poorer outcome. Even if you're screened on time, if you have symptoms, if you're not seen for your symptoms, you're much more likely to present with more advanced disease. So there clearly are personal concerns by people from this community.
What lessons can be learned from this, and what things can be done to overcome these problems?
Well, I think number one, the first lesson is I think we need more data. We need data actually on true cancer incidence and mortality in the LGBTQ population. So I think that's important. And secondly, the same things that are likely to drive risk for all folks, we need to focus in on this population too. Ensuring people have a normal, healthy weight, exercise, don't smoke, and decrease alcohol use. And then really begin to educate our students, our interns, our residents, that's really to have a much more inclusive, welcoming attitude. because if we actually push people away, the outcomes, particularly in cancer, could really be devastating.
Dr. William Dayhout of the American Cancer Society, thank you very much.
Yeah, thanks so much for having me.